እንኳን ለስምንተኛው የሀገር አቀፍ የህብረተሰብ ጤና ሳምንት አደረሳችሁ።
Jambo, karibuni kwenye makutano yetu ya miaka 8 ya wiki ya taifa ya afya ya umma.
مرحبا بكم في الاحتفال الثامن بالأسبوع الوطني للصحة العامة.
Bienvenue à notre 8e célébration de la Semaine nationale de la santé publique.
kusoo dhawaada xafladda sideedaad ee toddobaadka caafimaadka dadweynaha qaranka.
Oyei malamu na fete na biso ya 8e semaine ya santé publique.
Without any more delay, let's give Dr. Mohammed a warm welcome, who is going to be speaking to us about the history and significance of public health.
Thank you, Salim. Can you hear me? So it is an honor and pleasure to join you again for the second year. And this year, I'm given the task to get it started us off with the history and the significance of this National Public Health Week. First, Ramadan al-Kareem for those observing, and the rest of you, happy National Public Health Week. I would like to first congratulate you and the organizers, public health community leaders, attendees, the panelists that are committed to making this successful week. Just to give you the historical background and its significance, I would start us off with a Somali proverb that comes to mind. And that is iskashato makufto. Iskashato makufto. That is a famous Somali proverb, and it says, if people support each other, they don't fall. If people support each other, they don't fall. And I can see what Hibo was talking about, those keep it moving movement, like taking a small steps. That is how life is being built. Taking a step and building on it and counting, as Salim suggested, if you take only 10,000 or 1,000, and then if everybody does the same steps or more, then it accounts into a million numbers of steps taken by minors. So that is what I see this National Public Health Week has been built on, and that is the continuation and the effort that we are all making every day. Let me look back when this thing got started. The first National Public Health Week took place in 1995. That is 28 years ago. And since then, it has been increasing support over the years. But even if we go further, and if we now the theme of my talk will be the step and steps. So even 28 years, and then before that, it has there was an organization that a group of physicians put together. A group of physicians came together 151 years ago. That was in 1872, and that became the American Public Health Association. American Public Health Association was founded in 1872, 151 years ago. And then as they put every initiative, and public health initiative was one of them in 1995. And that is from that moment, in 28 years ago, every year we have this weekly, whole week of the 1st of April, Monday, which is Monday 3, April 3 today, till the 9th. And that's what we are celebrating. And I'm happy to see the faces that I see here and the organizers and the people who welcomed us with those wonderful language from Africa. New Mainers Public Health Initiative has been part of that growing movement from last 8 years in observing National Public Health Week. And this is, I'm happy to join you for the second year in your 8th annual. Why do we do this weekly National Public Health Week? It's a movement, because to have a US to be the healthiest nation on earth, it doesn't come from government alone. It does not come from the nonprofit alone. It is everybody's work, everybody's duty, and everybody contributing their piece and part, and that is how we will achieve to create the healthiest nation on earth. We are celebrating this week the power of prevention, advocating for health and fair policies, sharing strategies for successful partnerships, and championing the role of a strong public health system. National Public Health Week is the week to recognize the contribution of public health and highlight issues that are important to improving the public health. A lot of people don't know what public health is and what it does. So this is the week to highlight what we do and who we are. It is the week to unite around critical issues and focus our collective energy on the singular goal of helping people live longer, happier, and healthier lives. Public health is an integral part of the community health and well-being. It's also part of our greater world. Public health identifies areas of need, promotes health practices, and supports health lifestyles. This week focuses on prevention and reducing unhealthy activities, as Hiba points out. Communities across the country publicize events to help create healthy and fair public health policies. I remember last year this time, the first Monday of the month in 2022, we talked about racism as a public health crisis. We centered our discussion on how COVID-19 pandemic has challenged us and changed each one of us and our communities and the field of public health is in numerous ways. We talked about that. COVID-19 has magnified the visibility of social inequities prevalent in and between our communities. It has also shown us the importance of robust public health system that's informed by the cultural nuances of the community being served. Every year we have a theme. And last year we talked a lot of racism as a public health crisis. This year, the theme of the National Public Health Week 2023 is centering and celebrating cultures in public health. We have a great opportunity to highlight and recognize the way our communities and the diverse cultures have demonstrated resilience, and the diverse cultures have demonstrated resilience and contribute to influence our hard work to make the US a healthier, more equitable, and just nation. Celebrating and centering cultures in our way of helping to make cultural humility a standard within public health. So this week, starting today, and the daily themes that we have for this week will show how public health issues are connected, how they have influence of each other, and how they affect different communities. Learning more about public health issues within communities and their cultural frameworks will allow us the greatest opportunity to find the best possible solution so we can become the healthiest nation on earth. In conclusion, public health profession, our main goal is to ensure that our communities are healthy, safe, and connected. We are all integral to improving our public health system. By coming together and learning from each one of us, our cultural differences, we can use our collective power and knowledge to make the greatest positive impact. As we celebrate the 28th National Public Health Week, this week, starting today, April 3, 2023. We want everyone to know that you can make your communities healthier, whether it is joining the STEP group or physical activity team, safer, and also stronger when we support and stay connected, engaged with one another. As we adjust and adapt to new social norms, we are focusing not just on what we can do as an individual, but what we can do as a community, as groups, associations. And it was wonderful to see all language spoken and welcomed us today. So we can do as communities to protect and prioritize and influence the future of public health. I'm happy to celebrate with you today. And thank you. Thank you for inviting.
I want to now welcome our amazing guest speaker, Colleen Elias. She is Chief Executive Officer of Community Clinical Services, a federally qualified health center providing medical, dental, and mental health services in Lewiston and Auburn to more than 13,000 patients annually.
Okay, great. I just want to start by thanking everyone, particularly New Maine Public Health Initiative, for reaching out and for giving me this opportunity to be here to speak with you all during National Public Health Week. This is something that I and my entire organization is very passionate about, and we're proud to be a part of the Lewiston community and connected with community partners. We'll touch on the importance of community partnerships, but as already noted here, and I think everyone understands here that it's the individual and collective work that we all do that can help make a difference in the community and improve health outcomes. So I'm going to share my screen, so bear with me for just a second while I get this set up. Okay, can everyone see a PowerPoint on your screen? Okay. So I thought I would start with some inspiring quotes regarding public health and community health in general. I won't read all of these, but I think the one that stands out the most to me is from Dr. Paul Farmer. He was a pioneer in really health equity in delivering medical care to underserved communities, not just in the US, but around the world. And he posed this question that's really important for reflection, but central to health equity is this knowledge and belief in really holding people accountable to the fact that healthcare should be considered a human right. And so he asks, if access to healthcare is considered a human right, who is considered human enough to have that right? And I'm proud to say that in Maine, we're doing a lot of great work, and I'll try to touch on that a little bit about how people can be involved in policy advocacy. We do have an opportunity with bills that come out related to health equity, and one of them right now is regarding expanding Maine care to anyone regardless of their immigration status. Currently, it is restricted to depending on your immigration status. So there is legislation that is being advocated for. And I saw many folks from New Maine Public Health Initiative there. So we'll touch on that a little bit. I want to give a little bit background about Community Clinical Services. We are a federally qualified health center, and our mission is to improve the health and well-being of our community through patient-centered care, advocacy, and community engagement. I put community engagement in bold because I think that really speaks to what we're going to talk about today. Our vision is to lead the state in providing the highest quality of integrated, equitable healthcare. That's truly what we're striving to do, and we have a lot of work to do. And that's something that is always needing to be of focus, but that would be the highest honor. Our values are integrity, partnership, respect, commitment. We were founded in 1985 with a mission to serve the underserved, and we were designated as a federally qualified health center, look-alike in 2000. I won't get into what all that means, but a federally qualified health center essentially means that we, by law and by mission, we serve patients regardless of any factor, regardless of immigration status, insurance status, or ability to pay. And we provide a sliding fee scale for anyone that is uninsured or underinsured. We play a vital role as a safety net provider in the community, and we do serve over 13,000 patients every year in the Lewiston and Auburn communities. These are our service sites. So the location that most folks on this call are aware of is our B Street Health Center. We do primary care and case management at this site. We do have outpatient counseling. We have a pediatrics office, psychiatry, dental, and then we're in for the school-based health centers providing counseling and some primary. So I was asked to come to here today to lead session 1 on social determinants of health. And the objectives of this discussion will be to understand those determinants of health and the cultural impact, overview of the social determinants of health and their impact on communities, and discussion on the disproportionate impact on marginalized communities. So I thought I would start with this great visual aid that Kaiser Family Foundation put out on what the social determinants of health are. And these are the kind of the pillars and then the things that fall under what leads to social determinants of health. And these are kind of those things that if we are talking about health equity, we need to be addressing all of these areas. So economic stability, neighborhood and physical environment. We know that housing is a critical aspect of someone's overall physical and mental health, and safety. Education, food access, community and social context, being able to have social integration, community engagement, and then at the healthcare level, it's important that we provide coverage, accessibility, linguistic and culturally appropriate care, and quality of care. So the impact of social determinants of health, we know that where a person lives does impact somebody's health outcome, and primarily because of the physical environment. So we know that Lewiston is a old mill town, and there are issues of lead and mold and that sort of thing. And we have to be aware of that in the community so that we're taking action to mitigate those challenges that can put people at a greater health risk. And equitable access to care means across the whole continuum of care. So it's not enough for someone to access primary care. They should be able to access dental care, specialty care, mental health, substance use disorder, and fetal and maternal health. And we'll talk about that a little bit more coming up. Communities can address social determinants of health in a variety of ways, but it does require intentional community-led initiatives across several stakeholders. So having a forum like this is the perfect opportunity to kind of discuss those and to build upon. Having access to food, shelter, quality education, all of these things are critical to addressing social determinants of health. Understanding social determinants of health, the cultural impact. So in addition to the pillars that we talked about that are individual levels of social determinants of health, there are also social determinants of health that are more broad-based, that are at the community, population, and national levels that, you know, an individual doesn't have control over, and it takes more of a broad look at addressing, and that includes migration, poverty, territory. When we think about our Native American cultures, these things are more broadly defined social determinants of health. So discussion on the disproportionate impact on marginalized communities. I put a couple of headlines here over to the right. This was really highlighting the fact that Maine, even though 2% of the Maine's population are Black people, they made up a quarter of the COVID-19 cases. We made national headlines, which was terrible for the disproportionate impact of COVID-19 cases on the BIPOC community. And so these were just kind of headlights there. And, you know, after the national kind of alert, that's when communities jumped into action rather than kind of being at the forefront. But it really helped to elucidate the social and economic inequities in disadvantaged communities. And then this image here is really, I want to like highlight the sad statistic that still exists, that pregnancy-related mortality ratios are 3.2 times higher for Black women in this country. And that's really important for providers that are in this community or in any community where there's marginalized populations to be understanding. A lot of times we hear that, you know, someone might seek care at a later time because they didn't know, or they were scared, or they were afraid they wouldn't be able to afford the cost. And so we need to make sure that we're addressing these challenges. And there's other health-related reasons why pregnancy-related mortality ratios are higher, but we have to be taking care of the person and understanding these disparities so that we can address them. Let's see. So we've talked a lot about social determinants of health, and then kind of the other side of those social determinants of health are what the result is, so the cause and effect. So health disparities, there are definitions. I like the CDC's definition of health disparities. It's preventable difference in the burden of disease, injury, and violence. And preventable is the key word there. And there are disparities that negatively impact whole groups of people that already face significantly more barriers, often due to the factors listed here. We've talked about many of them, but you know, sex or gender, geography, being in a rural setting versus urban, having a disability, someone's sexual orientation, how they identify. Those are all factors that can impact good health, but that's what we're working to address by addressing those social determinants of health. So how do we address health disparities through community action? I just put a few kind of ideas up here, but it's important, you know, we've talked about the workforce and really building upon that. But education is key, culturally appropriate, linguistically appropriate. Education is important. I think the Lewiston community does a really great job with this, with English language learners, and they have great programming around this. Address issues within a social and community context, expand access to health care, and improve health literacy. That is really key, as it was discussed in one of the breakout sessions, how you know, regardless of somebody's language, they should be able to access the same level of care as someone who speaks and reads English or doesn't read at all. You know, we need to be able to provide equitable access to care, and that includes written and spoken language. Improve the quality of housing, so doing work around lead prevention, and really holding this is more at the city level, but holding landlords accountable to making improvements, and you know, ensuring that there are, you know, if it's a 4-story apartment, that there are safety locks on the windows so a toddler can't fall out, that there's easy access to escape during a fire, and all of those things. Really, code enforcement has some work to do around that with our aging housing community. Mitigate barriers to care. Coverage is a primary reason that people lack access to healthcare. Again, we accept patients regardless of ability to pay, insurance status, or any other factor. But we run into challenges with trying to refer someone for that continuity of care. So somebody has something going on with their heart and they need to see a cardiologist. Is that cardiologist going to accept somebody with no insurance or with main care? We meet a lot of barriers around there. Promote the use of community health workers. I think Maine is really catching on to the great work that community health workers do. We really understand that they play a vital role in that bridging the gap of understanding between provider and patient, and really getting out in the community and meeting patients where they're at, and really, making sure that care is possible for anyone in the community, regardless of social factors. Enhanced case management. Case management is, I think, an understated field of work that doesn't get the praise and kudos that they deserve, because they really do really connect people that need a little bit of support with the resources that they need. And I think that's so much about healthcare, is that it's how do you navigate that? Well, case managers can really help navigate that and so much more. If someone needs help with heating or with, a temporary need, they can really connect them with that, or with legal services because they're having an issue with their landlord. And it's important to partner with local law enforcement to ensure that police brutality and that sort of thing is being addressed as well, and ensuring that, there's not racial profiling and that sort of thing, because that is harmful to entire communities. Let's see. So this slide talks about, okay, what can we do? What are the strategies that we can implement to address the healthcare disparities? To advocate communities, I think we do a good job kind of at the nonprofit level and even at the individual level, but I do think there can be some improvement around community-led collective voices. So, really uniting on a message and taking, an entire community and saying, going to Shelley Pingree or going to Jared Golden or our local representatives to really say, hey, this entire community is seeing this and we need your help. Community advocacy defined is a strategic approach to influencing outcomes and driving change on behalf of your community. It involves representing your community's rights and needs to the level of government best able to respond. And I put some examples of how to advocate here. There are many things that at the individual and collective level that we can do. If there's something that you see needs change, you can start a petition. You can protest things that are really controversial and really concerning and really unjust. You can support advocacy organizations such as the Maine Immigrant Rights Coalition. You can provide written or public testimony on bills. So it's important to kind of follow what's going on in your state government. You can write letters to the editor. Policymakers do read those, and you can always request to meet with representatives. You are their constituents, no matter your status. They work for you, and it's incumbent upon all of us to hold them accountable to the vote that they got to be where they're at. And then really, using forums like this, I'm so appreciative of this opportunity to really help educate others about the issues that matter. I think that we can't do this enough. We get busy in our day-to-day, but bringing variety of community members together, it's so insightful. I'm already hearing great ideas and want to connect with so many people. So those are some ideas. No, I'm talking a lot. I will leave time for questions and other discussion. So some best practices for promoting a health in all policies approach. One of the things that became apparent to me early on in my healthcare career was this realization that healthcare is the gateway to all other social services. So if somebody can access a primary care provider, that is really a great stepping stone to be able to connect with, housing resources, or if somebody has something going on with their mental health or substance use disorder or a developmental disorder. It really starts with a primary care provider, and they can help work through that, stabilize, and refer to the experts that specialize in that. And it really helps to bridge those gaps between, being here with social determinants of health and getting to this point of health equity. Best practices are to engage community stakeholders and to advocate at the local, state, and federal level whenever necessary, form alliances among community leaders with a shared vision for improved public health, and stay informed on legislation and work towards community-led advocacy.
Wanted to also ask if Sue Russell could talk to us a little bit about the LED program. We discussed it a little bit in our breakout group. So Sue, I want to give the floor to you to share that with everyone a little bit. I know we only have about 20 minutes, so I want to give you that time.
Well, thank you. And I think Hebo is going to join me in talking about this. I am the training co-director for the New Hampshire Maine LEND program, and Hebo is actually on our LEND faculty. So she's going to join me as well. And LEND stands for Leadership, Education in Neurodevelopmental and Related Disabilities. And it's a training program. And I'm going to share my screen if I am able. Let's see. Let me just get to the right page here. So the LEND program is a leadership program, as I mentioned, that is interdisciplinary training program focused on disability, as I mentioned. It is a interdisciplinary program, so that we have in our program, we have what we call long-term trainees, and those are students. Here's actually the cohort for this year, our trainees, as well as our faculty, and there's Hebo. And Hamda has also, Hamda was a LEND trainee as well. And so it's interdisciplinary in several ways. So we have graduate students from the University of Maine and the University of New Hampshire who are in fields who are interested in disability. So we have early childhood education, social work, psychology, OT, PT, public health. So we have graduate students in various disciplines. We also have practicing professionals in the field. So those could be case managers, community health workers, people who work for child development services. So people who are in the field and are actually practicing or doing work in the area of disability. And then we have people with disabilities in the program as well, and family members of people with disabilities who are in our program. So it's very interdisciplinary, and we do that on purpose. We want all the voices to be at the table as part of this training program, so that as our trainees are learning about the field of disability, that they're learning from graduate students and professionals and people with disabilities and family members. So it's really, we work hard to have it be interdisciplinary. It is a pretty rigorous program. It's 300 hours over an academic year. And we do have a stipend that we provide to help offset expenses associated with the program. We usually begin in the fall, and we end in May. So this is a little bit about the program here. We have three core areas. We have our what we call our, I'm going to turn it off so I can see people. Oh, hold on, Salim, that's the wrong one. That's UNE Lend. Let me share the right one. Okay.
Thank you so much, Sue.
Let me put the right one in the box. There is another Lend program. The one that was shared is actually the Maine Lend, and that's at down at UNE. Ours is a partnership between the University of Maine and the University of New Hampshire and Dartmouth. So I'm going to share that one. This is the one that Hebo and I are involved in. So I'm gonna, Hebo is gonna share some information out with people in the group. I just put the link in the box. We're recruiting our cohort for next year to begin in September. And again, we are looking for graduate students, professionals, parents, people with disabilities who to participate in the program. We love to have folks from the New Mainer community or our other diverse communities in Maine as well. So if you might be interested, you could reach out to me or to Hebo. Hebo, what else would you? Hebo was also a Lend trainee. So Hebo became involved with the program back several years, and she used to come in and do lectures for us and provide and work with us in several ways. And then we recruited Hebo to be a Lend trainee, and she was, and now she is on the Lend faculty. And then, as I mentioned, Hamda was also a Lend trainee. So Hebo or Hamda, would you have anything you would add to that?